Who is at risk for developing severe complications from the coronavirus? People who have underlying medical conditions. We've talked about lung disease, COPD, diabetes, heart disease, other problems, other associated medical conditions that up the risk. You need to be more vigilant about social distancing and about immediately recognizing if you have symptoms and contacting your physician. Restaurants, grocery stores, etc., you may be more likely to come into a contaminated environment. It's really more the environment that poses a risk here. It's less likely that somebody is going to cough in your face or sneeze in your face, but they may drop onto the environment. You touch, you come into contact, and that's where you then expose yourself. So that's where staying away from that environment and washing your hands being the number one thing you can do to avoid this. So if you go out, anytime you touch something, think about it as the chance to wash your hands or use an alcohol hand sanitizer. What exactly does community spread mean? Community spread refers to the activity of any infection, and in this case coronavirus, spread throughout the community where people are exposed without any known direct contact, let's say with somebody who just traveled from a country where it's been seen. You had no contact with anybody who's traveled. You really may not have even had contact with anybody you know who was sick. So that means it's widespread, it's a virus that's being shared amongst anybody and any environment, and you just happen to be exposed. Again, without known contact to travel to a reported country where the disease has already been seen. It's now out there, and we're all potentially at risk from other people who may be asymptomatic, who may have this virus and yet to be sick, who may have shed it into their local environment, and now you come into contact with it. Again, this is where the number one thing you can do is hand washing. If you take our experience from influenza and other viral infections, this is always the watchword. Wash your hands constantly. Avoid touching your face. Have etiquette if you sneeze or cough. Cover your mouth. Throw away those tissues. Wash your hands. And that's how we can curtail community spread.